A warm welcome to everyone. So, without any further delay, let's dive into the virtual sea of knowledge and exploration. So, let's get into the session. Today, we are going to discuss about the topic women wellness, holistic approaches for PCOD or PCOS, and hormonal balance. Today, Dr. Sona Balu is here to present on this topic. She is a leading yoga therapist. Over to you, Sona.
Namaskara, myself Dr. Sona Balu. I would like to take the sessions with a women's healthcare topic. The topic is completely holistic approach towards the PCOD, PCOS, and hormonal imbalance. I would like to explain what is women's health first, because it's not starts from the PCOS, it starts from the puberty. The woman's health, it's a longer journey which starts from puberty, menstrual cycle, pregnancy, during partum, and delivery time, which is partum, and postpartum, lactation time, and remenopause. This is the longest journey. Very recently, we are facing with this very occasionally need to be heard by the PCOS, PCOD, the doubts behind that. I would like to explain all those things. And there is another doubt, secondary view of it, whether we can approach with a holistic. Yes, we can. So let me explain it. I would like to share my PPT. The PCOD, PCOS, hormonal imbalance, these three are literally interlocking interlocking conditions. The hormonal balance, which leads to the PCOD and also leads to the PCOS. The interactions of those things. And it's harmfully deviated from the normal structure to the functional organisms generally associated with certain signs and symptoms differentiated in the naturals. The disease is commonly exhibited from the signs and symptoms into its abnormal states. The full form of PCOS disease and polycystic ovarian syndrome, which is most common nowadays. It is out of 10, 6 out of 10, it's frequently. It is endocrine disorder also. Metoendocrine disorder it is. So what is PCOD actually? It's a medical condition in which a woman ovarian, it's immatured ovum. The matured is not developed, or the partially matured, or it is larger in sizes. So this cyst formation, along with the cyst formations, this is called PCOD. Also, PCOS, the conditions, the ovarian productions is abnormal amount of androgens. There is a present of male sex hormones, just testosterone and other androgens. So the small amounts of cyst, which is most common here. The hormonal imbalance, there is nothing but too much excretions of the hormones and less productions of the hormones than the normal production quantity. It's called hormonal imbalance. Here the differentiations of the cyst presentations and the normal ovary. The difference between the PCOD and PCOS. The PCOD, it's very common. It's pretty common. So you can easily identify with immature, irregular menstruals and partially impure eggs, the shape or the development of the egg ovum, which is transforms into cyst conditions. When it's come to PCOS, the more severe conditions, which is ovary produce a high quantity of the male hormones, resulting in the excess of cyst formatting. Worldwide common as the PCOD. PCOS is a disease affects fewer from the PCOD cases, not everyone. So PCOD does not affects your fertility conditions. Most of them are fear about it as no, it's not. We can. The concept is most possible from the PCOD cases. It's a reversible conditions, not like PCOS. PCOS is affects the fertility definitely, as the woman is not ovulating regularly. It is difficult to conceive, even though the risk of miscarriages and premature birth and complications during the pregnancies, these conditions, complications during the delivery, parturition times, it's also pretty common in PCOD cases. And there is no serious complications in the PCOD, yes, but not more. We can manageable. PCOS, it will give the associative complaints like type 2 diabetic, hypertensions, coronary cardiac conditions, as cerebrovascular accidents, and endometrial carcinoma, breast carcinoma, vaginal carcinomas, cervical carcinomas. These all will be developed with the PCOS. And PCOD cases, it's lifestyle manageable. The lifestyles and your physical activities, these can be really helpful for the PCOD conditions. And PCOS is not much be curable, but the management and control through the lifestyle management is it's possible. And PCOD, it's a metabolic condition. It's not related with the other systems like thyroid, means again endocrines. It is not very simple terms, we can call it as thyroid and other insulin. These and all it don't mostly affect it. It's mostly comes with the metabolic, liver, digestions. These conditions only it will mostly go with it. Yes, yeah, it's endocrine. It will affect the other systems also like cardiac and pancreatic. These kinds of other systems also it will affect us. When it's come to PCOD, there is lots of minimum 10 to 12 cyst formations will be available. But comparatively, PCOS will have very less cyst, like less than that. So this will cause us to the carcinoma, its leads, but in PCOD cases, mostly it is reversible. PCOD is a reversible, PCOS is not reversible. The causes, from where we are getting the causes. The causes of PCOD, PCOS, hormonal imbalance, there is no exact and scientifically, yes, we have, but still not at much proven. So the associative causes, these are like genetic, environmental, endocrines, metabolic, psychosocial, and genetic factors related with mothers related genetics. Usually it's affected. And supraspinatic nucleus and hypothalamus pulmonary ovarian axis, pituitary gonadal axis, and pituitary adrenal axis, these are completely related with the hormones. You can ask me what are all these ovarian axis and gonadal axis and all. It's all creating few hormones like gonadotropins, which will secretes for FSH, LSH, like follicular stimulating hormones, which will secrete the follicles, ovums. That will help to reduce those things. These are when it's these all affected is obviously amenorrhea, and anovulations means less ovum, or the ovum production might be mismatches there. When it's come to that, it's usually affects. So that's the gonadal axis and adrenal axis. Yes, adrenal means ovarian axis will lead to steroid hormones and gonadotropin hormones. The symptoms. It's usually look like so similar, but mostly it's not. When it's come to PCOD, it is weight gain, obesity, heavy pain. It's a severe pain during your menstrual cycle, dysmenorrhea, what we call it as, and irregular cycles. It used to take approximately 40 to 60 days, more than 60 days, interval of your cycle. Heavy bleeds during menstrual cycles and The male pattern baldness, rare infertility cases, it's rare. And when it's come to the PCOS, is quite longer. The irregular cycle, oligomenorrhea, and missed periods, amenorrhea. I mean, it's missed more than 6 months. There are cases like that, and heavy menstruations, amenorrhea, and ex, excess of hairs and pelvic pains. Not only now, it's a pelvic organal pain. Some of the cases might get, and in our inner areas, mood changes, hair losses, and infertility. Definitely. Let me explain the pathophysiology. It starts from the neuro. So pathophysiology, there are two, threes are there. Let me explain one by one. Because when it's come to pituitary, adrenal, there is one path. When it's come to the insulin residence, there's another one path of the pathogenesis. So the pathogenesis starts from hypothalamus, where the excess of the LH, which is luteinizing hormones, and that will stimulate the yes, that will reduce the follicular stimulating hormone. Okay. So that will abnormal ovarian cells response, thecal response. So reduction of that, again the parasine secretions. So adrenal will release the excess of adrenogens, which leads to the excess hair growth, like the beard kinds of all those things will start like that. That will it will disturb the follicular development. So definitely that will lead to the infertility. Also, like very depth we supposed to go. So I'm giving the knowledge of all those things. Insulin residence, it is hyperinsulinemia. It's type 2 diabetic. It is type 2, like stimulation of the thecal cells, that androgen secretions enhanced. This will hyperestrogens that will enhance the LH. So that will also lead to the PCOS. When the early of the LH is the granular cells in the small follicles, that premature the ovums, and that will lead to the no ovum production there. The ovum production will be reduced, so that leads to the PCOS. Same androgens will the variations that leads to the PCOS. So these are all like same hormonals which disturb the each departments, so that will affect the ovulations. When it's anovulations, stoppage of ovum present productions, so that stimulates the hormonal imbalance, and other associative complaints will be followed by the here the overall hormonal imbalance and hyperandrogenism and insulin resistance investigation part. We find out the PCOD and PCOS. The physical examinations by the look, observation, palpation, percussions movements, what actually the medicos will choose. So that will show those anatomically physiological conditions of the patients. While looking only, the physician can identify the excess of hair growth, the mood swings, how the opponent is communicating, and the palpations, the organelles, how the positions are, how while palpating we can observe some organal imbalances. Coming to the laboratorial part, blood investigation, pituitary investigations, examinations of adrenal, thyroid, cholesterol, blood sugar level, FSH, LH, progesterone, testosterone, and prolactin. When it takes to the laboratorial reports, yes, definitely it will shows. And pelvic ultrasound. Pelvic ultrasound, there is two ultrasounds are there. The one is a vaginal ultrasound. The another one is transparent. ultrasound. So to identify the cyst, number of cyst, size of cyst, to identify the cyst, once we are using the ultrasound examination. I would like to explain approaches towards the holistic topic is, but I want to communicate the complete language, complete knowledge about the approaches and the ways to be cured of the PCOD and PCOS. How we are managing in this modern world. There are modern medicine, Ayurveda, Siddha, naturopathy, Unani, and homeopathy. There are medicines, alternative medicines are available in this world. Before explaining alternative medicines, what actually the world is facing right now, that's modern medicines, how they used to approach the client, how to approach and ensure how to treat the PCOD, PCOS cases well. Let's start from the diet. Modern medicine approaches the diet, regular exercise schedules, and the hormonal treatments, ovulations, injections, medications, laser treatments to reduce the darkness and excess hairs, and infertility treatments, and laboratorial surgeries can help to destroy the androgen production in the tissues itself. And the regular monitor to the hormonal levels helps to prevent the PCOD problems. So these are the approaches and these are the basic steps how the modern medicine used to approach it. The medications in what's modern medicine world is using. Progesterone to reduce the to connect anorexia or the absence of the periods. Progestin it's used to. Word birth control pills. It is contraceptive pills actually. Some birth control pills contains estrogen and progestin and helps to reduce the androgens levels in their body. This is helps to the complex of the ovulations and letrogens and clompines. These are helps to induce the ovulation. These all will induce the ovulation, but there are the other complications also. It's there. And metformin, it's very common in the insulin resistance and helps to the weight reduction too, which is lifetime medication. And immature follicular aspirations, it helps to the follicles initial stages of when it's come to the PCOD initial stages, immature follicular aspirants used to use because the follicles and the ovums is very immature and improper structure to develop the growth of those things. It's used to improving the populations. And laboratory ovarian drillings, the laboratory drilling, it's minimally invasive surgery and that helps lower the testosterone levels, produce the ovaries. It induces the ovary productions. So these are the steps used to from the modern medicine world. So the final step to the is surgical or the removal, or the next step is laser. So lifetime medications. This is what modern medications it's approaching. When it's come to holistic approach, there are 5 I said: Ayurveda, Siddha, Unani, homeopathy, and yoga. There are lots of treatments and the medications used from the Siddha and Ayurveda because there are intake of Taila, Churna, it's available. Also, to balance the doshas, we used to use with from the Ayurveda, the Churna. The other part, there are external treatments too. There is not only internal medication, there are external treatments too, it's available. When it's come to Ayurveda, it's completely examined from the Tridosha, so that will define from where is the lag is present. So Udvardanam. There are other treatments like Udvardanam, Abhyanga, Shirodhara, and Podikili. Shiropichu. So these all will help to balance the dosha and balance the um, hormonal levels so that it will function very smoother, healthy way. To support their treatments, there is Varnadi Kashayam, Sukumaran, and Raja Prapattini, Anutaila, Trifala. These are churnams and kashayams is available. This Kancharna Guglu, familiar treatment of medications which is taken from Ayurvedic people. Also, when it's come to Siddha, churnams and legumes is most familiar. Kalarchikai churnam, which is traditionally used from the ancient time, and Triphala, Kumbhaku churna, and Niradi Mukku. It is Niradi Mukku. And Padiga Pungavai, it is Ashoka Pati and Chukutaila. These are all followed from the upgrades of the siddhas. And not only the internal, there is a diet plan and external physical activities and the treatments also needs. Can internally and externally supports. When it's come to yoga, holistic approach towards yoga, it starts from the detox of your body. Yeah, itself, the name itself telling we are cleansing. We're supposed to cleanse what is the toxins present in the body to remove all those things. Once we cleansed everything, then only we can take the good things in our body. The adaptation is most needed. When it's come to yoga and naturopathy, this is like yin and yang, we can't split it. So the yoga, when it's eliminating, when the simultaneously when the naturopathy treatment starts, the body start reacting with the vitals. The natural vital starts reacting. We are supporting the system actually. Pranayama, relaxing, and to give the metabolic, to stimulate the metabolic conditions, relaxation technique. So relaxation to calm down your mental health, and meditation to observe yourself what's happening. It's not only just meditation, the difference between the meditation and relaxation only it goes so to observe and to know what's happening inside the human body. The meditation is most important. To calm down the mind is relaxation techniques. There are lots is there upcoming. And mantra yoga. Mantra yoga, which is chanting of mantras. The mantra yoga, swara yoga, kundalini yoga, lots of yogas, branches of yogas are there. When it's come to mantra yoga, there are specific mantras for the each and every conditions. So chanting of these, so Sanskrits have the powers to encode the positive energies. So mantra yogas and the swara yoga, it's a music therapy, music healing. So swara yoga is also a part of healing here. This is from the holistic approach of yoga. The next, it's a naturopathy approach. Naturopathy having the lots of therapies, which is very traditionally Asian we are following, but there are very peculiar and needs to be concentrated. Acupuncture, acupressure, which is stimulate the energy of the human body. The reflexology, which plays almost to be example of to give the examples of foot, arm, ears, and eyes. It's present. It is actually the connections between the all organs and the external digital part of our body. That's reflexology. And when it's come to mud therapy, yes, cold therapies, it is actually there are treatment with the mud, but the cold treatments to the human health, it is really helpful and it's curable. Hydrotherapy, which is water treatments, manipulated therapy, massages, all kinds of massages comes under us, and fasting therapy, intermittent fasting, juice fasting, and it depends the person's, it varies the what kind of fasting is needed, whether it is a protein diet or any other fasting, intermittent or long-term fasting, are in 16 to 8 hours, 16 plus 8 of fasting. The fasting is a quite far topic. Previous doctor also explained about this. And diet therapy. Diet is internally we supposed to care PCOD. It's not just about external or internal and removing the hysterems. It's not just because of the outlook. It's actually inside. It has mental health and physical health. It's most interlocked. That's the reasons it's leading the PCOS and PCOD. Diet is most conscious, whether it is a iron content that's needed or other we supposed to concentrate, and accordingly it a customized diet therapy is needed. Aromatherapy. There's a smell therapy. The scents used, a number of scents it's available. It's depends the person's, again. It's choose, and there are internal taken and external. In external, there is application and the smell, just breathing exhalations or to the meditation. There are other ways to utilize the aromatherapy, and heliotherapy, chromotherapy, and magnetotherapy. These are all rarely, but still available in our hospitals to improve the other level, to show the other level of resulting of the conditions. The helio is nothing but the heat, sun, basically. Chromo, it's a color. Magneto, it's a magnet. So there is a natural, artificial, it's again another topic. These are the topics, these are the ways to cure and manage the PCOD. And the holistic, it's not just a word or something, it's completely a lifestyle. So it's really helpful to cure the conditions from the root cause, not to manage the symptomatic managements. It's a root cause. So the holistic approaches of these will cure the conditions completely. So there are research papers how it works and how it's really actually it's works for the people. So I'm attaching few of those papers. The first paper, it is study of evaluate the effect of integral approach of yoga and naturopathy on the polycystic ovarian syndrome. It is last 2022 of March. And the paper is actually 25 years old female. Her case actually does took into the case. She was getting her cycle almost 45 to 65 days of interval gaps. And in this interval, she used to get almost 10 to 12 days of bleeding for each cycle. The heavy bleeds and severe dysmenorrhea, the menstrual pain. So these all the complaints are also associative complaints with the upper back pain and the lower back pain and the severe abdominal pains during her cycle. Previous cycle time also, she used to get almost 10 days. She used to get her abdominal pain and the upper thorax, which is breast pain, she used to get. So this her case actually, her height was 164 centimeter and the weight was 70. I'm explaining this case actually. This 70 kg. This 25 years old female approached a holistic. So with this, the followed by the diet, only through yoga, and later the pastime of naturopathy. Treatments, it's the treatment almost taken 3 months of followed by regular practice. In this regular practice, she really reduced her complaints, and that's the paper here I'm attached. The result is significantly proven here. Next, second paper is a study to evaluate the changes of PCOS morphological after the naturopathy and yoga intervention. Yes, so they proven we can reduce the size of the cyst also. There are treatments. This is actually 12-week challenges. It is observed with the two groups of people. One is control group and another one is interventional group. Each group having 25 number of people. Thus here, the treatments, it's what they actually followed. It's mud therapy, hydrotherapy, manipulative, fasting, diet, and yoga. This was actually followed 12 weeks, and it's significantly proven the people who are in control group reduced the size of the morphological of the cyst. The third paper is Kapalabhati pranayama. It is pranayama. So it will help the PCOS and PCOD. That's the paper, and Kapalabhati worked on it. The Kapalabhati is the Kriya pranayama. It will excrete forcefully and inhale deeply. The deep inhalation and passive exhalations. This is actually a Kapalabhati that will really correlate it with the cerebrocortex. So that treats all the neuro conditions that results here to reduce the PCOD conditions. That's the actually science behind it. The next is we came to the conclusion part. So PCOD, PCOS, it is the endocrine metabolic conditions which is need constant monitoring and support. There is no standard conventional management available as it is a lifestyle disorder. The holistic recognize the condition and the balance between the physical and mental health rather than the concentrating the episode care to manage the symptomatic. It looks the interactions between the well factor of the treat the whole person. It aims to prevent and the as well as the health issues. All the naturopathy therapies are aimed to support the body's vital so that it can enhance your immune systems. Hence, all these measures like diet, yoga, cold therapies, manipulative therapies should be for achieve the better health results.
So thank you, Dr. Sona. It was really good information. So any other questions from the attendee side, you can post your questions in the Q&A. Hope there is no any other questions from the attendees in. So thank you for participating, Dr. Sona. By this, we will end the session.
Thank you, dear.
Yeah, a big virtual thank you to each and everyone for making our webinar a grand success. Thank you so much.